so if you were just looking at because you've probably got a better insight into what doctors are earning within the areas that you work, are you noticing differences within the different populations of doctors?
Absolutely. So you certainly see differences among specialties and even geographic regions around the US. But one of the things that I found to be quite disturbing, my mom actually pointed out right when I started my firm, and it's the salary gap for women doctors and doctors of color. So just to call it out, there's a ton of data out there that doctors can Google, but I've aggregated a lot of it where you can see that women physicians, both generalists and specialists, are paid lower, substantially lower than their male counterparts for the same jobs, same work, same schedule, same, critical patients. And then likewise, doctors of color also earn less. And so, one of the missions as a part of my business has been to educate doctors on how to prepare for success in your contract. So, yes, we can help you and we're here for you. And we want doctors to know how to advocate for the best contract for their practice and ultimately for their patients.
Okay, so this would be a salaried position and they're being just offered less off the bat?
Yeah, there's actually a ton of data out there that shows. So if you look at, just to stay on the gender lines for a moment, if you look at generalists, women generalists make in the ballpark of 30 to 40, sometimes $50,000 less than their male counterparts. And then secondarily, specialists. So this is from a resource called Medscape, which publishes annual surveys of physician compensation where they aggregate all this data. Secondarily, when you look at specialists, those women are making about $96,000, so about six figures less than their male counterparts for the same work. Now, there's copious data out there also for people justifying those imbalances, but there's nothing that I've seen in the literature that would support why women doctors are paid less than men. And yes, to answer your question specifically, we're talking salary to salary, job to job. I see it all the time with doctors I negotiate for. The overwhelming majority of my clients are women, and we always end up getting them more money. Well, why is that? Because they're underpaid to begin with.
Very interesting. Is there anything that takes into account hours spent within that salary?
Yeah, there is. And there are people who would say that because women historically work fewer hours than men, that then in turn they should be paid less. But I don't agree with that. And the reason I don't agree is for two reasons. One, the data also shows that women spend more time with patients. And when you spend more time with patients, data shows you have better outcomes, you have better patient satisfaction. And the data also shows that they do administrative things above and beyond just the clinical work. So yes, you can certainly account for hours, but this is looking job to job, hour to hour. Women are paid categorically less than men for the same work.
I think I was coming at it from almost the opposite. So if they were employed for the same number of hours and salaried, do we have any data about how long it takes men versus women to do that? Because I'm thinking that if there is a difference in women working in the evenings and weekends compared to men, but I haven't seen any data at this stage.
Interesting. Yeah. So I do think there's now Medscape would be the best resource for this. They show how many hours a week men work versus women work. Now, of course, these are what people report. Now, I don't know how that correlates to that disparity in pay. It's like, well, they're working more and being paid less. I don't know exactly what that math is. I haven't gone that far into the analysis because for me, the analysis begins with why are my women doctors being paid so much less than their counterparts? And let's fix that.
Mm-hmm. Oh yeah. So we're not absolutely not going to disagree on that part. I'm just noticing from my perspective, the under earning that occurs because this 0.8 position is taking more than a 1.0 to complete.
Interesting. Yeah, I haven't gone that far into the analysis, but I certainly think there could be some data to illustrate what that kind of what that distinction is between what men work and women work and how that exacerbates that underpayment.
Yeah. And it may not even be a gender piece. It's just curious, isn't it? So more questions than perhaps that we could answer today, but that's okay.